Thank you. I know we're a wee bit behind time, so I will speed up. I won't go through all my slides because I've got lots. But thank you for the invitation and just to be able to share our journey in Inverclyde. So Inverclyde is a community of 80,000 people in the west coast of Scotland. And if I had key messages to say today, would be you just have to get started. I made those phone calls. Don't be frightened, just go out there because conversations just lead to great things. And the other thing that I would say is relationship is key on every single level. We had an ageing population, we recognised that, and we didn't have all the health resource to accommodate that. So what were we going to do in Inverclyde? And, you know, I heard Professor Kelleher speak way back in 2003, and I was so inspired by his speech at that time, and it was reach people where they are. I was so blown away by that. My background's in palliative care, my background's in hospice, but actually I knew that we had to get outside those walls and do something really creative in a way that reached a whole lot of people. So our project is grassroots. This, what I'm going to share with you today, is grassroots, but at the same time, what I'm doing is nurturing the relationships with the key people at the top. So what we've been very fortunate to do in Inverclyde is, now this is where is the person who chaired our board was the Chief Officer of the Health and Social Care Partnership, but she's now the Chief Exec of Inverclyde Council. So it was really, really important to establish that because, yeah, we're starting at grassroots, but that person at the very top is 110% behind us. So I was the Director of Care at Argown Hospice. I got the opportunity to look at this piece of work for 3 years as a secondment, and I was able to do that in 2016. But it didn't officially launch until 2017. And why? Because it was so important to hear the voice of the community. It was so important to build the relationships up in the community, to actually understand what does our people want, not what we think as professionals that they would like. So my funding for my post was at the time funded by Argown Hospice, but then I got 50% from the Health and Social Care Partnership. I'm the only paid person within Compassionate Inverclyde. Every other person that I work with is a volunteer. I'll say the word volunteer, we don't use that language, but you'll understand that. So volunteers, and there was no budget, so everything has been created by people and places through belief in what we're doing. And can I just say, this doesn't happen overnight. It has taken lots and lots and lots and lots of conversation to make this a possibility. Actually, from the idea to 2016 to 8 years. And then it's taken another 8 years to get to this point. So it doesn't happen overnight. So yeah, there are, I looked at different approaches across the world. Here they are. I'm not going to dwell on that. I'll just move through these. As I say, I was inspired by Professor Kelleher's work. Also, locally, we had a Compassionate Communities Conference that showcased the work in Inverclyde as partnership between the hospice and the healthcare professionals. And during that time, we asked people to sign up to a statement to say, if a compassionate community was developed, is that of interest or whatever? And that was in 2011. Didn't start till 2016. So it wasn't airy-fairy. It is in the policy. So at the time, Scottish Government had the living and dying well. Communities was right in the midst of that. Our local council had a nurturing communities strategy. And also there was another action plan for end-of-life and palliative care by Scottish Government. So this was not airy-fairy stuff, but it was about people in the community and how we empower our community. So that was the conference, and that was the statement. So that was the kind of building bricks. What did I do? I went out and started to engage with people. And as I say, that was almost 7 months while writing pieces of work, but I really spoke to every single established group that was within Inverclyde at the time. I'm whizzing past these, but I'm just so aware of our time, and I want to just put wee nuggets of key things in. This is vital. Setting up a board. Now, a board sounds very grand and it's constituted and all of that. This was not. It was a steering group. But on that steering group needed to be the key people in our community that could make decisions. So I tried to get, the kind of top people that were able to say yes to pieces of work or say no to things that and that they were involved right from the very word go, so that there was buy-in, so that people understood what we were trying to do. I also at the time got a Florence Nightingale travel scholarship, and I went to Australia, I went to Frome, and I went to America just to look at how's the rest of the world doing this, or are we behind, or where do we sit with the rest of the world? And I was pleasantly surprised that we're actually way ahead of the people at the places that I had visited, apart from Frome, which is in the UK. So what did we want to do? We wanted to create Scotland's first compassionate community, and really, I had not a clue what that would look like. I understood the theory and I understood the public health approach, but actually, how would all of that work with the people in Inverclyde? And we had the strapline at the time, ordinary people, helping ordinary people. So this really has been a journey of empowering our community. Now you look at this community here. Over 100 people sitting here who have skills, who have experience, who have knowledge, who have something to give to their community that is valuable, that makes a difference. So I didn't have any outcomes at the time, so that was great. The board agreed that we didn't have any outcomes, so we weren't fitting into trying to work towards outcomes that we were never, you would lose valuable information by just trying to stick to outcomes. But I did have strategic objectives, and those objectives were to be looking at well-being, promoting compassionate citizenship, raising awareness about kindness, and working with organisations to see how compassionate they are as employers. But way back, I told you, I'd spent so much time working with the people and listening to people in Inverclyde. And actually, when I went through the data and the conversations that I had, those 3 words were the 3 words that was most commonly used when they were explaining what our community was like. So if you like, that was in the soil. Inverclyde was a compassionate, helpful and neighbourly place. So it was there. It was a no-brainer, it was really the foundation of what was then we've been working towards within compassionate community. But what I was determined it wasn't going to be another service, another palliative care service, because it wasn't. This is about ordinary people. It was a community development approach. However, it had no blueprint. So it was the notion that it would organically grow, if you like. It wasn't prescriptive. It wasn't, here we are and we have to work to this particular framework or whatever. And that seemingly has worked. Because if you look at what we've created and what we've developed within Compassionate Inverclyde, it's kind of went a bit feral. It was at first really focused on end of life, but actually people were saying to me, what are you doing about social isolation and loneliness, and what are you doing about schools and all of these things? So my very first project, because I couldn't wait to get started, so I was still the director of care before I started Compassionate Communities. I knew that something really important needed, it was so important, and I just intuitively knew that it was going to be good. Started in the schools. We all know that term, and normalising death and dying in society. What is that? Like, if you said that to somebody in a school, they would be like, I don't know, a young person wouldn't know that. So we started to work creatively with young people, and we used key values as the bridge. They had key values, the hospice had key values, and we started to use that as, okay, you come up with a project about your key values and come to the hospice, and we'll listen to your project. And then we told them about the hospice, and that was how that piece of work started. That was a long, long time ago, but it was really instrumental in building relationships with the schools, especially. And we've continued to work a lot with schools. So here's some statistics. This is what we've achieved so far, I suppose. No One Dies Alone is an American programme. I explored that when I was out in America, and we were the first in Britain to run No One Dies Alone. It's completely volunteer-led, and now all of our volunteers have went through the End of Life Ease course. So that's about death literacy. So we now no longer, if I see a volunteer saying, oh, they passed away, they will know that I would be like, they've actually died. So it's, these wee nuggets of, listen, it's okay to say die, it's okay to say death. So I've got 60 active volunteers who are No One Dies Alone companions at the minute, and all of them have went through the End of Life AIDS skills course. And then you can see the ripples. They're then talking to their family and saying, actually, that's not helpful to say that. You need to say dead or death or dying, these kind of things. So we've supported, that's actually, since I've put that up there, we've actually supported 160 patients in our No One Dies Alone. And that's when a companion goes and sits with somebody at the end of their life, the last 3 days of life when they're actively dying. If they have no one, it will be around the clock until the person dies. We have palliative care visitors. We go into and help families look after people at home. I've worked with 14 organisations to help them look at how they have compassionately dealt with bereavement and grief in their workplace. What's your policy? Do you actually have a policy? And a lot of people's policy was like, you get 2 days. Somebody close to you dies, you get 2 days compassionate leave. Isn't that great? Well, actually, no. So I've helped organisations really look at their bereavement policy, and now some of them, the braver ones, have said that people will get 10 days paid bereavement leave for their loved ones. And also we've included small steps all the time, service animals within that. Because can you imagine, I was bereft when my dog died. So can you imagine if a service animal died and you're expecting somebody to come back to work the very next day? Absolutely, like how uncompassionate is that? So 14 organisations now in Inverclyde have their bereavement charter mark. And that's a recognised mark from Scottish Care that that organisation has seriously considered bereavement support. And within that, we've managed to get over 250 members of staff within all of these organisations had some bereavement training. so they understand that grief's lifelong, that it doesn't go away in 6 months, you'll be okay. No, life goes on, but the grief stays the same, but it's a way of knowing that that's okay and it's normal. We had set up 2 bereavement cafes, but they are now friendship hubs. We've taken part in a No One Grieves Alone festival as part of the creative arts. We take part in the Absent Friends Festival. I run pet bereavement courses. And as I say, all the NODA companions have been trained in the ease. And then just really kindness in the community. That was the kind of other part of it. We have back home boxes that people get when they leave hospital. And that has come from a conversation around, like when you go on holiday and maybe your friends or family bring you a pint of milk and a loaf of bread for you coming home. Well, we started thinking, what would that be like if you're getting home from hospital and there's nothing in your house? Who supplies that, especially if you don't have anybody? So remember, no budget. We've given out over 5,000 boxes, and that has come from the kindness in our community of donations. We wanted to involve the whole community, so the young people in schools learn about the back home boxes, they learn about kindness, and they make welcome home cards that go in the boxes. Local people knit or crochet, and a wee handmade crocheted blanket goes in, so it's a real community effort. We've got a friendship hub that is completely run by, now remember, I'm the only paid person. Everybody else is volunteers, so that this is sustained in the community by the people in our community because they've taken ownership. We've very recently trained new mums. So that's nothing to do with end-of-life care, but it makes a difference in the community if a new mum is struggling with her wee one, and it helps the nurturing and attachment if we're able to provide someone who's been trained to go and just help that new mum in the first few weeks. So we've got a caring cuppa scheme in local cafes that you can go in and pay, that pay it forward thing, you pay a coffee and somebody else can take the benefit of that. And we've developed a wellbeing walk, and I also run wellbeing programmes. We've got kindness awards. So kindness awards given to some and recognised, an organisation who's been kind to their employees, or anybody can get a kindness award, and that's we're just trying to change the narrative to positivity and about good things happen. Good things happen to people as well as bad things happen to people, and all of these things. Now, these are bad slides, but it just gives you the notion of the vastness of the relationships and of what we provide. So that's us in the middle, and that's who we are connected with. Relationship is key. Make the phone calls. It can really happen and make a difference. This is Scottish Government, and this is their performance indicators. And what they said was, we're a society which treats all of our people with kindness, dignity and compassion. Well, if you come to Inverclyde, I hope that we'll be able to tick some of these boxes that we fit into those key indicators. We've won 18 awards, including the Queen's Award for Voluntary Service. I was privileged to accept the RCN's, the Royal College of Nursing's Nurse of the Year. So it meant that they recognised nursing and can be creative as well as, so I thought that was a risk that they took by choosing me to be part of the Nurse of the Year for that year. So we've won 18 awards. I'm not going to go through this because it's feedback from people just expressing their gratitude for NODA and back home boxes, the High Five programme. Where we're at now is we've just become, because it was so feral and it now doesn't lie within the kind of memorandum and articles of the hospice, then I left the hospice in June, and we have established our charity. We got charity status last September, established a new board. We're having a launch event on the 9th of October. We've got funding from the big lottery for 2 years. And now I'm going to be able to get 2 other part-time staff people to help. Because what we're able to do now is start the next piece of work. So this is organically growing from listening to the community, and now we're going to target the Inverclyde Council and all the other organisations to say, okay, so here's evidence. We've built up a reputation, so let's seriously look at how we become a compassionate city and follow the charter, and then start thinking about palliative care policy in different organisations. That's my wee new office with the logo on the window. So I'm going to just end with a film that was made a long time ago. So please ignore the statistics because they're all wrong. But it just brings the programmes alive. Do you know, you'll see real people doing real things, ordinary people making a difference together. And that's the start of what has been our compassionate community's journey. So I'm hoping if somebody can help me put this video on. Compassionate Inverclyde is a social movement. It's a movement of looking and working with our community to work with ordinary people and making everyone recognise that they have something to offer somebody else, in particular at the time of need or at the end of life or in crisis. I had 4 strategic objectives, and they were about improving wellbeing, raising awareness and education, developing compassionate citizenship, and helping organisations become more compassionate. Compassionate Inverclyde offers a No One Dies Alone programme. And No One Dies Alone, really, it's for people who are actively dying in the last few years of life, who don't have family or friends visiting, or if their family are exhausted, or if a family member would like to be with somebody when they die but is frightened to be there on their own, then we can support that. Since December, the 1st of December 2017, we've supported 62 patients, and we've sat for over 1,700 hours, and I've trained 109 companions.
The back home boxes are given to anyone being discharged from hospital who lives alone.
And in the box goes essential items that would allow somebody to make a hot drink and a light snack when they get home. But not just those essential things for eating and drinking. There's a blanket that's hand crocheted by or knitted by somebody in our community. And to get the children involved as well at all ages, the children in all the local schools and youth groups will make welcome home cards, and a welcome home card will go in the box. And we've given out nearly 2,300 boxes since November 2017, so roughly about 30 a week.
Back home visiting is people that have been discharged from hospital, they're over 80 and they're alone and they need some company.
You can come and visit and sit and have a wee chat with them, and a wee cup of tea and things, and just general chit chat about different stuff in their lives and things that they want to talk about.
And we've also got a friendship hub, and that started as a bereavement cafe way back at the very beginning, and then we recognised, why are we siloing bereaved people into their own group? Why don't we just bring our whole community together? So no matter what the need is, you would come along for a coffee and a connection and chat.
You just need to ask for something to say to you, anything at all. When you think of people, they've got a lot of thought. The girls are very compassionate, and that's why they call it Compassionate Inverclyde here.
We have a singing group, so we sing together, and that is again for loneliness and social isolation, and that's just for fun. It's not a choir or anything like that. It's just to bring people together.
It's great fun, absolutely brilliant fun. Anyone can go.
The feedback has been amazing. People have felt less socially isolated and lonely.
They are just overwhelmingly appreciative of what we're doing, which is humbling from our perspective. To be able to support people is humbling.
I think it is important to the community and to Inverclyde, because it does help a lot of people that's lonely out there in the community. There's an awful lot of people, and Compassionate Inverclyde really bring all these people together.
It's just been a catalyst for an opportunity to actually start to be kind. And kindness is infectious. And the more people start to be kind, the more other people want to get involved, and they see the benefits, and the benefits to young people, old people, people in between.
It's like one big family, the Compassionate Inverclyde.
I think it's essential now. Don't know how we haven't done it for years.
It's easy to get involved in, and it just allows anyone who is a human being to offer their skills and their experience and their expertise to somebody else in a way that's beautiful.